my very first application to the local authorities at that time, most certainly they did not understand the meaning underlying my demand. Well, the head of the health care system in our city probably has understood this now. This is something that's being performed throughout the rest of Europe. It's the first one in our country. This is a non-private, that is a public hospital that has a complementary medicine division. This is the entrance to the ward, which is inside the hospital, the public hospital of Merano. Complementary medicine is first and foremost for oncological patients in the health district of Merano. The patients come to us, sent to us by the resident physicians, but independently of the disease and independently of the state of the patient. The procedure is that we have an interview with a patient, and then we decide on the specific therapies. The methods that we use, as you saw, are acupuncture. All our physicians have had at least 3 years training in these systems: phytotherapy, osteopathy, homeopathy, dietary science. There are individual targeted systems, especially as far as the digestive disorders are concerned. Movement, according to the Sportschule of Cologne, are used here. Hypothermia, infusions according to the laboratory analyses, galactosium, selenium, and so on. Shiatsu, massage techniques, lymphodraining, for example. As I think you have gathered, the focus of all of our work is to improve the quality of life, increase strength, reduce collateral effects, and increase safety. Complementary medicine is performed directly in the ward. There has to be a reservation made, but the patients are admitted to therapy after having provided their routine data and after having signed their informed consensus form. It's a 2-year project. We might call it a pilot project. There are, of course, some compromise has had to be made. And agreements had to be made with the National Board of Physicians. There were some members who did not wish for this division to be set up. A fee has to be paid of about 40 euros for a 30-minute interview with the physician, but there are some cases in which the patients are exempted from paying this ticket. Office hours are between 8 and 16, 8 and 4 p.m., and between 8 and 12 in the morning, all reservations can be made. Now, the assessment of everything that's made goes through the Charité University in Berlin, and Dr. Claudia Witt is dealing with the assessment system. There is a scientific committee which is evaluating the situation, and I myself am the current director of the board. We have 4 full-time doctors, 4 nurses, a physiotherapist working full-time, a psychologist working full-time, 2 secretaries working full-time, and of course we have cleaning persons and the director of the project, Christian Twile. I would like to bring his greetings to you. He was unable to attend here today. He will certainly come to a future meeting or conference. We sincerely hope that we will be able to carry on our activity as well and as successfully as we started it. If you happen to be in the area of Milan, do come and visit, because it's a very positive experience. Thank you very much for your attention.